Shield of Alaska is committed to addressing a wide range of rural healthcare challenges to improve access and affordability of health services for all Alaskans. We're grateful to Premera for their support in this shared mission. It is now with my great pleasure to introduce Jeff Rowe, CEO and President of Premera.
Good afternoon, or I guess morning still. Across the United States, people living in rural areas have less access to health care and are not as healthy as their urban counterparts. Rural residents in general are more likely to suffer from chronic disease, more likely to be disabled, and more likely to die younger. The challenges faced by rural communities and rural healthcare systems are unique, and in Alaska, ever more acute. Resolving them requires innovative solutions pursued by a cross-section of partners, and that is why Premera Blue Cross Blue Shield of Alaska is here this morning. Good morning, and thank you, Roel, for the nice introduction. I'm delighted to join you today to announce several important new partnerships in Alaska to address pressing needs in rural healthcare. I'd like to welcome and just introduce also our president from Premera, Blue Cross Blue Shield of Alaska, Jim Grasco. So welcome, Jim. Thank you. I'm going to touch on two topics related to rural healthcare today. The first is how Premera is helping address the enormous disparity in health status and in healthcare in rural areas. The second is to talk about the great partners on the ground here in Alaska who will be receiving the grants we are announcing today. In 2018, Premera committed to invest more than $100 million to improve access to care in rural areas and to address issues of health equity and behavioral health, particularly as they relate to homelessness. This $100 million pledge highlights our company's commitment to the communities in which we live and we work. Premera has been the health plan for Alaskans since before statehood. And second, our pledge reflects the obligation and the opportunity we feel as both a health plan and a corporate citizen to actively engage to make healthcare work better for all, no matter their geography. By improving the health of rural citizens as well, we also hope to bring down the cost of healthcare for everyone. One way that Premera is working to fulfill that commitment and address the health-related challenges in rural communities is by partnering with others who are tackling these issues. In designing our program, over the last year, we met with more than 80 organizations in more than 50 communities across the states of Alaska and Washington. In fact, it was almost a year ago that a cross-functional team of Premera employees, including medical and behavioral health specialists, joined with our partners at the Rasmussen Foundation and traveled across Alaska to witness firsthand the challenges facing remote areas of the state. Our conversations with community leaders led us to conclude that Premera will have the greatest effect by investing in 4 areas. The first of those is recruiting and training more doctors, nurses, and health aides to work in rural areas. There's a shortage nationally, and that's especially pronounced here in Alaska. The second is integrating treatment of behavioral health into our primary care system. An individual's health needs to be understood and treated holistically. Integrating primary care with care for behavioral health problems such as addiction and childhood trauma is critical and frankly long overdue. The third area is expanding consultation assistance. Rural clinicians often do not have the resources to provide specialized psychiatric and substance abuse treatments. We will fund more consultation platforms for those rural clinicians. And finally, improving rural capacity to evaluate and treat mental health crises. Individuals experiencing persistent mental health issues end up repeatedly in emergency rooms that do not have the capacity to adequately care for them. We will fund rural emergency departments to better evaluate and treat these patients. In short, we have an opportunity here to close the gap in care for rural Alaskans. To that end, I'd like to invite our friends and partners from the University of Alaska Anchorage, from the Rasmussen Foundation, and from ANTHC to join me now as we announce Premera's commitment to improving health care in rural communities. If you would do the honor of revealing the pledge. I can't tell you what an honor it is to be here and to be a part of this. I'm very pleased to announce 3 grants totaling nearly $6 million. The first, Premera is committing $1 million to community health aid programs across the state. This amount is divided into 2 grants. We have earmarked $300,000 to go directly to support community health aid practitioner programs. The first grant will be going to Norton Sound Health Corporation in Nome to support their efforts in and around that area. Additionally, we will be awarding grants to Yukon Kuskokwim Health Corporation in Nome and Tanana Chiefs Conference in Fairbanks. Each will receive grants of $100,000. I'm also pleased to announce that our host today, the Alaska Native Tribal Health Consortium, will receive $700,000 to support the build-out of their Anchorage-based education and development center, helping create a state-of-the-art integrated healthcare education institution. The EDC will provide a home to 3 tribal community health provider education programs dealing with medical, dental, and behavioral health. Second, Premera is awarding University of Alaska Anchorage $1.77 million in a grant that will significantly increase the number of nursing students preparing to serve in remote and rural areas. This grant also includes capital funding to upgrade training facilities for these students. Finally, Premera is investing $3 million to partner with the Rasmussen Foundation to fund grants to rural clinics for small capital improvements, equipment, and other material needs. To learn more about each of those, I'd like to welcome first Alex McKay, who's the Vice President of Programs at the Rasmussen Foundation, who will give us some background on how this grant will be used. Alex?
Thank you. Good morning. It is my pleasure to be the Vice President of Programs at the Rasmussen Foundation, where we work to implement or continue the Rasmussen family legacy through grants. We do this under the leadership of our board and our President and CEO, Diane Kaplan, who unfortunately can't be here today, but sends her congratulations and excitement about this partnership. The foundation connected with Premera originally in 2018 during the Grantmakers Tour, where we had Paul Hawley as a participant. That's an area of the foundation that works under Vice President Angela Cox's leadership to partner with foundations from the lower 48. You know us more for the grants that we do directly, but we also do partnerships with people in the lower 48. We were able to show needs and challenges on the Grantmakers Tour to Paul, and then the group from corporate came up and wanted to really look deeper. I really appreciate, we all really appreciate that they took the time to really visit rural communities. They went to Bethel, they went to see our friends in Napaskiak, to Nome, and to Unalakleet, to really see firsthand what's needed. So these grants that they're doing today are really based on what they heard and learned as they talked with Alaskans across the state. It's not uncommon for rural communities, as we know, to be cut off from higher level medical service than we have here in urban communities because of weather or other circumstances. We're glad to partner with Premera on this new grant-making venture that is really specifically focused to address these needs in rural communities. This partnership will enable local clinics to acquire the critical equipment that they need as first responders, and lives will be saved. That's what we're going to do through this $3 million fund. It's a small grants fund that we are helping to administer. It's invested at the Anchorage Community Foundation, and we know is going to have a lot of impact across the state. It's a time-limited fund, so we are going to grant this out over the next 3 years, and it'll be used to address sort of issues of equity that were appreciated by Premera between urban and rural communities, access to quality health care, and through the other grants is really going to make a huge impact. Dr. Gary Ferguson has been contracted to manage the grant making. On my team, program officers Roy Aguilin and Charity Summer are working to put it all together and really deliver on what it is Premera's asked us to do. Dr. Ferguson was the former CEO of the Rural Alaska Community Action Program and has served in director roles at ANTHC, so he's among friends here as well, and knows a lot of the players across the state and we know is going to bring a lot of value to the program. We're so excited about this. This is really one of the best possible events or activities that we engage in, and really can see how our money is going to be leveraged in partnership with Premera, so thank you again to Premera. This collaboration is really wonderful. It took a year of planning on Premera's part. Thank you all for your partnership in making this happen. I'd like to introduce one of our partners, Chancellor Sandine, who I've had the pleasure of knowing since she came in 2018. I think before she actually arrived, we had lunch. And we've been so impressed with her leadership and grace and the impact that she's having. So welcome.
It is my pleasure to be here as well, and also my pleasure to serve as the Chancellor of University of Alaska Anchorage, which is our own urban metropolitan access university right here across the street. As Jeff has indicated, the healthcare costs in Alaska are the highest in the nation, and these costs are even more acute in our rural communities. Because our healthcare providers often recruit from outside the state of Alaska, they're paying extra relocation fees and bonuses, for example, in order to meet the healthcare needs here. That drives up costs, obviously. And even for those various healthcare providers, doctors, physicians, nurses, and so forth who come up to Alaska, and even if they stay in Alaska, many of them lack the cultural awareness that makes them very successful healthcare providers in our rural communities. I haven't been here very long, as you know, you heard just about a year, but I've had the distinct honor and pleasure of traveling around the state. I've been to some of our hubs in rural communities, including Bethel, Utqiagvik, Quinnahock, and so there's nothing like that firsthand eyewitness experience of seeing what these communities are like. And I know that our state is made up of hundreds of these smaller rural communities. Each place is different, and it makes our state unlike any other place in the United States. So our healthcare providers in these communities face a steep learning curve in engendering trust of the communities that they serve. We also heard about nurses, and nurses in particular are the one segment of the healthcare workforce where there is probably the most acute need. We have learned from the Alaska Department of Labor and Workforce Development that on an annual basis, we have open positions for about 80 nurse practitioners and over 500 registered nurses throughout the state. That's a lot. And this is because of the attrition and turnover in these positions, but also because of growing need for nurses in the state of Alaska. So all of these add up to huge challenges, but with our partners, including Premera, of course, we think we have the solution, and that is to grow our own healthcare workforce right here in Alaska. And UAA has been working hard on that front for a number of years. We have been identified by our regents as the lead campus for healthcare within the University of Alaska system. And we are providing healthcare programs of various sorts in 14 different sites around the state of Alaska. And so we're well underway on this goal to double the number of healthcare graduates by the year 2025. And nursing is an emphasis. So this very generous gift from Premera will help us expand on that work. And in particular, we will be focusing on expanding in Anchorage, but also mainly Bethel, Dillingham, and Ketchikan, where we already have nursing programs, and we're going to be expanding those. This will allow us to greatly increase the number of nurses that are trained here in the state of Alaska and who will stay here in the state of Alaska. I want to point out that when we look at the communities of Bethel and Dillingham, those communities are mostly affiliated with the University of Alaska Fairbanks, and of course Ketchikan is affiliated with the University of Alaska Southeast, and I want to give a shout out to Chancellor Rick Caulfield, who's here from Juneau, for this announcement. And this is a perfect example of the type of collaboration across the universities that we are engaged in to serve the state of Alaska. And thank you again to Premera for encouraging us to do even more of that. So because of this generous gift, nursing students within the state of Alaska will increase across the 4 sites. Our goal that we will accomplish is to have 238 new nursing students over a period of 5 years, with an additional 54 students per year after that. So the goal is to be sustainable in creating additional nurses. Most importantly, I want to emphasize that 3/4 of these students will be studying in rural communities, and we hope and expect that they will stay in those communities. So kudos to Premera and our UAA team who worked really hard on putting this program together. Dean Jeff Jesse, who's here, Associate Dean Kathy Kraft, as well as the development officer who was here working on this, Greg Gallagher. Thank you all. And I'd like to particularly call out the efforts of the School of Nursing faculty around the state. I know that we have some of our students here as well, administrators of our program, but you know, when you think about training nurses, that's not a simple task. I mean, these are tough subjects. They have clinical experiences that need to be supervised, and they need to pass licensure exams. It's not like just any degree program at UAA. There's extra elements and extra complications. Then you think about what we've done. We've asked our faculty and staff to expand and to bring in new additional students. And then we've asked them to operate in multiple locations and to teach in a distance format and to coordinate clinical placements throughout the state of Alaska. We are asking them to do a lot, and they have really stepped up, so I do want to recognize and thank them for their efforts. So it's also an honor to be here with all the partners, not only Premera, who's being so generous, but the Rasmussen Foundation and ANTHC, and to say that we're together in this in helping the state of Alaska. So knowing these partners, Alex McKay, Diane Kaplan, Andy Tuber, Rolf Helgeson, and others, we stand hand in hand to do what we need to do for the state. UAA is a university that's highly connected with the community, interested in serving the community, and we really are honored that Premera recognized that, and we will step up to the challenge. So thank you again for your generosity. Thank you for all of you for being here to witness this wonderful event. We appreciate it very much. Thank you. I'm in trouble now because I'm supposed to introduce our next speaker, who is the president of ANTHC and a regent of the University of Alaska, Andy Tuber.
Well, thank you, Chancellor Kathy Sandine. It's a real honor to be here today. It's a real privilege. Jim, Paul, Jeff, thank you very much. We're going to invite you back more often now that we see that you come bearing gifts. Your generosity is extraordinary, and I can't thank you enough on behalf of Alaska Native people across the state who will be benefiting from the generosity here. The Alaska Native Tribal Health Consortium was formed some 20-some odd years ago, 1997, and since that time we have partnered across the state with tribal organizations, tribes, and our people and communities that are oftentimes the most difficult to get to, the most expensive to serve. And with your generosity today, we have the opportunity to outfit a training center that's going to allow for an enhanced and more robust opportunity for our young people and students in a mid-level training capacity for behavioral health, dental health, and community health aides. And so I can't extend our appreciation enough. I know that Premera is invested. We look to you for ongoing partnerships. The consortium has been involved in community health and in the healthcare industry in ways that are required to be novel. The dental health aid program, for instance, is the program that we modeled from a program in New Zealand for the purposes of bringing healthcare costs down, whereas the U.S. was the last industrialized nation that had or that at that time did not have a mid-level training program for dental health aides. We're partnering now with the Veterans Administration and other providers to ensure that our approach to bringing healthcare costs down is shared, and what we've seen is that with these models as they've been developed, that other communities across the U.S. are embarking on the same path. Today, our award for this $700,000 that you've committed will allow us to outfit our training center across the street. We congratulate our partners at the University of Alaska Anchorage, Yukon-Kuskokwim, the Norton Sound Health Corporation, Rasmussen Foundation, and we can't say thank you enough. Thank you, Jeff.
Well, it's always a good day when you can do good. It's an even better day when you can do good together. And I'd just like to thank Kathy and Alex and Andy for their participation in this and really the work that you have ahead of you in implementing these great programs. We're very honored and privileged that we could be a part of your tremendous efforts, and we thank you. Thank you all for being here. We will be around to answer questions to the extent there are any. I appreciate your commitment to this event and, of course, to the state of Alaska. Thank you again and have a great day.